You're welcome. It's another edition on Time with a Gynae. Today, I'm going to spend some time to talk to you about antenatal care. So, over the weeks, in a few episodes, I've been talking about preconception care, and I explained and gave you a lot of information on preconception care. Today, I want to talk to you a little on antenatal care. But wait, if today is your first time or this is your first time on my channel, please subscribe, share, let's educate ourselves together. We are more into the health of women, especially during pregnancy, avoiding pregnancy complications, and how to go through pregnancy with ease. So that's the purpose of this channel. So share, subscribe, and let others also join. So when we talk about antenatal care, it is the health care that you will receive before you get into labor. That's basically what it means. So it starts from the first day you get pregnant. Now, I explained in the previous episodes that for you to enjoy a positive pregnancy experience, it starts right from when you decide to get pregnant, hence the need for preconception care. So now, when you get pregnant, the advice is that immediately you miss your menses, don't wait. Please look for why you have missed your menses. There are a lot of reasons why a woman can miss her menses. And one of the main ones is when the woman is pregnant. So if you have missed your menses, you may be pregnant, or it could be due to other things. But basically, you're advised to do a pregnancy test at home. So that one, you can use your urine to do the pregnancy test. And if it's confirmed as positive, I'm sure a lot of you can read what positive means. So once it comes out as positive, the next step is that you go to the nearest hospital, get a scan done. Now, the essence of the scan is to confirm the pregnancy. Take note that confirmation of pregnancy is not done when you get a positive urine pregnancy test. Confirmation is by an ultrasound. So the ultrasound could be abdominally or it could be through down there. So it's very important because sometimes when you're pregnant, it may not be a pregnancy that is in the womb. Now, for us to say that a pregnancy is normal, the pregnancy has to be normally located. And the normal location of a normal pregnancy is when it is inside the womb. So when it's inside the womb, that is when we can say that this pregnancy is normal. And that can only be known when you have done a scan. So once you do a home pregnancy test and it's positive, the next thing is that you go for an ultrasound scan, and then that scan will let us know whether it's a normal pregnancy. Now, if it's a normal pregnancy, then it's treated as such. If it's otherwise, and I'm sure on other episodes, I'll talk to you about the other forms of pregnancy which are deemed abnormal. But today, if you do a home pregnancy test, you do a scan, and it's normally located, then you are lucky. Your pregnancy is good to go. So we start antenatal care. Now, for the antenatal care, you are encouraged to start as early as possible. The advice is that at least you should have 1 or 2 visits in the first trimester. The first trimester is the first 3 months of your pregnancy. Every pregnancy is divided into 3. We have the first trimester, the second trimester, and the third trimester. The first trimester is very important. It's very important because the first few weeks are the very critical days of the pregnancy where most of the parts of the baby are formed. So if there's any intervention that has to be done for you, it has to be within that period to save your baby from anomalies or abnormal development. So it's very important that you visit the hospital for when you are first confirmed that you are pregnant. It's very important that you go to the hospital, and then the various things that need to be done. Now, what has to be done? On your first visit at antenatal clinic, what happens is that depending on where you are going for your clinic, the midwives will initially assess you. They will take some information from you. They will fill a book for you. They will check a few things. They will check your blood pressure. They will check your sugar. They will check other things. They will check your height. They will check your weight. They will check quite a number of things just to make sure that you are fine. And then afterwards, they fill a book for you. They take a history. The history is if you have been pregnant before, the things that happened during that pregnancy. If you haven't been pregnant before, cool. Other things like your family history is taking your personal history. Personal medical history is also taken, your allergies, drugs you are taking. Now, all these are very important, and I want to highlight on one today. So, especially on the drug history, you may be taking some medications, and I'm sure in the preconception care video I mentioned it. You may be taking some medications that may not be good for the development of your baby in the first few days of the pregnancy. And it's very important because some medications are actually able to inhibit the formation of some organs of your baby. So like some medications can actually stop the development of your baby's kidneys. Some can cause a lot of anomalies or a lot of abnormal developments. So one of the essence of going for your antenatal clinic very early in your pregnancy is to make sure that all those medications are stopped, and then you are started on the right medications. And even this calls for a more attention to preconception care, because you would know that if you had gone for preconception care, all those medications would have been stopped already, so that even in the early days that you are pregnant and you might not know. And this is normal in our society, in our part of the world. A lot of people get pregnant and then they probably do not know. They wait for another month before they test. Most of the organs of your baby are formed in the first few months, like first 2 months of the pregnancy. So it's very important that preconception care is taken seriously, because you may not start your antenatal clinic early. So some medications are taken care of. They are stopped. The ones that need to be changed are changed so that it doesn't affect the growth of your baby. There may be other lifestyles that may not be healthy for you in the early days of your pregnancy. So that is also taken care of. And it's very important, because you don't want to get to a stage where the baby has formed already, and then now you're going to the hospital and it's found that you're on a medication that has a potential harm to the development of your baby. So it's very important. Today, my focus is to hammer on the fact that it is important to start antenatal clinic as early as you get pregnant. And 2 reasons I've given today. In other episodes, I'll share the very salient reasons, other reasons why it's very important to start your antenatal very early. One of the main reasons that I've given today is that starting your antenatal clinic early helps locate the pregnancy to determine whether it's a normal pregnancy. I'm sure you may have heard of ectopic pregnancy. I'll explain and talk more about that in a different episode. But your pregnancy could be an ectopic pregnancy, which is life-threatening. So it's very important that you go early. The pregnancy is picked up, it's confirmed that it's intrauterine or it's in the womb. And then they also look at your health status, your history, to determine if probably you're on a medication that is harmful to your baby's growth, especially in the early days of the pregnancy. So this is the first episode on antenatal care. I'll see you in other episodes with salient information on antenatal care. I want to remind you once again, this is Time with a Gynae. My name is Dr. KK. If this is your first time on my channel, please subscribe to the channel, like my videos, share for others to learn. Don't hesitate to ask any question you have in the comment section. I'll be glad to attend to you. I'll see you in the next one.